Hello again, everyone. It's Dr. Mike. I'm back here for tip number 35. Now, this one is one that is going to rattle some feathers. But if you're a medical exercise professional out there, okay, your feathers got rattled. But this is the new game. And when I say new game, the new standard in medical exercise training. Do I need to check blood pressure on all my clients? Okay. It depends. Now, I know that's not a good answer. I know it's not, but it really does depend. If your client is referred to you with hypertension, then you must check blood pressure before and after each session. Now, technically, you should check it during the session, but that becomes very difficult. You should check blood pressure levels for all of your new clients. New clients coming in, you check their blood pressure because you don't know who's hypertensive. And folks, guess what? I'm a hypertensive. I was diagnosed as a hypertensive individual when I was a lieutenant. I was an infantry officer when I got out of undergraduate school. The Army paid for me to go to school, and I was assigned at the 82nd Airborne. I was a paratrooper. I was in great shape. Now, if you're at the 82nd Airborne, every morning you're out running and you're doing PT, and it ain't easy PT. It ain't just a job. You're really putting in the distance. But I was diagnosed with hypertension. I was taken off jump status for about 2 weeks and went to the medical clinic literally every day until they finally just realized, hey, you know what? You've got essential hypertension. It doesn't seem to be anything of a major issue. Your blood pressure values are such that you can continue on active duty. And I went back on active duty for the next 7 years and never had a problem. So please check blood pressure. Let me continue with this. This is mandatory. Remember, hypertension is the silent killer. You have clients that may look normal, healthy, and active. Hopefully, I look normal and healthy. But you may find they are hypertensive when you check their blood pressure. This may save a client's life. Folks, I had no idea I was hypertensive. For hypertensive clients, every time you check their blood pressure, record the values and share these recordings with the client's physician. Folks, you may save a life. Also, maintain a copy of the recordings of in the client's chart. Check blood pressure for stroke survivors. Even though they had a stroke, they may have had stroke because of blood pressure issue, because of a blood clot, but check their blood pressure. Even though they survived the stroke, they still need blood pressure checks. Their hypertension and diabetes didn't just go away because they had the stroke. Make sure you understand acceptable blood pressure values for exercise. Exercise and diet play major roles in the management of hypertension. Find a registered dietitian and develop a relationship whereby you provide the exercise and the registered dietitian provides the dietary component. Package this program or this combination and market these services to cardiologists, family practitioners, internists, nurse practitioners in your community. Also market a program similar to our hypertension, diabetes, and obesity program, which I've talked about previously. That's part of our MedFit group training programs. Folks, I cannot tell you how important it is in this day and age to check blood pressure on every new client, and then on your hypertensive clients, you must check blood pressure and record it. You must. Now, I'm not sure if many of you are aware of this, but now Medicare actually rewards medical doctors for checking blood pressure when clients come in for follow-up visits. Now, in my opinion, that should be standard, but if the federal government says we need to do this as a means of managing and preventing, but being in front of these conditions, I think we as medical exercise professionals should do that also. So please, if you would, get yourself a stethoscope and a sphygmomanometer. Also, get yourself a very good blood pressure cuff and start checking blood pressure. One of our best students, a very good friend of mine, Jason Hodge at Medical Fitness Pros, he actually has a station where when clients come in, they have to pass the blood pressure station. And they sit there and they check their own blood pressure. He has a number of charts or forms there where the client can now record their own blood pressure. So it's almost on an honor system. And it really does make a difference. It makes the client have skin in the game in managing their hypertension. I think that's a great idea. So I give kudos to Jason for that. So again, thank you for watching. Make sure you get your copy at MET101ebook.com. And if you have questions about managing hypertension or this idea of blood pressure checks or utilizing blood pressure monitors, email me at drmike@postrehab.com. Take care. Thank you.